I recently read in the Toronto Star that there's a problem with mental health issues in our Ontario universities and colleges. Olivia Nikoloff began seeking counseling at her university in her first year in 2013, but didn't get it until this year, 2017. That's 4 years. That's ridiculous. And even she knows it. She said, thankfully, I didn't have anything that was truly dangerous to me or my friends, otherwise I wouldn't be here. And that's concerning. The article also says that there has been a 344% increase in calls to the mental health helpline since 2010 by people younger than 26, and that between 2013 and 2016, there was an 86% increase in substance abuse, and suicide attempts rose by 47%. One researcher analyst, Danielle Pierre, said, if suicide is the #1 killer of our youth, of our teenagers, why are we not up in arms trying to deal with that? I don't know. It's a problem, and I'm tired of knowing that it's a problem, and I'm tired of not doing anything about it. The Mental Health Commission of Canada found that between 15% and 25% of our children and youth suffer at least one mental health problem or illness, and that 70% of mental illnesses in adults have their onset during adolescence or childhood, and that 70% of childhood cases of mental health problems can be solved through early diagnosis and interventions. We could have saved so many lives, so much suffering that has been going on right now, and so many attempts at lives. But we haven't done anything. Teachers even agree. The Canadian Teacher Federation also ran a survey on teachers' opinions on mental health and found that 79% agreed that stress was a pressing concern, and that 7 in 10 have not received professional development to address their mental illnesses in their schools. We're not doing anything to provide for teachers who are seeing these kids at their youngest and developing them and have no idea what's going on. They have no idea what to look for or how to help. Well, what has the government done? Well, we do have a document called Supporting Minds, and I will tell you that it's really good. It provides a lot of information about what to look for and what to do, but it's not mandated, and there's no policy regarding mental health, and it's just not good enough. One of the principles that we should be trying truly to abide by in Supporting Minds is that individuals of all ages and at all stages of life must be offered culturally relevant services that meet their needs. They need equitable access to those services as well as opportunities to participate in the communities free of stigma. We would be doing this. This is mandatory that we should be doing this. Well, what about the curriculum? Here's the thing. I looked up the physical education and health curriculum, and mental health doesn't show up until grade 5 in the category of substance abuse. That's not enough. Mental health should be its own category. It should be taught from kindergarten all the way up. And as far as I'm concerned, should be its own curriculum, should be its own separate document. Luckily, the Canadian Teacher Federation also came up with solutions, and I can't agree more with all. I agree with all of them. We should be doing all of them right now. One is to commit to a comprehensive federal poverty reduction strategy, because poverty is truly proven to show that it increases mental health problems. So we should be trying to figure that one out too. Collaborate with the government and educational associations to develop and fund a national program aimed at supporting schools to both promote mental health and prevent and address mental illnesses, so that we can increase human resources to support schools, families, and communities, and enhance opportunities for teacher professional development, because teachers now need to know about this, need to be able to help. And then the best solution I can think of that I agree most with Canadian Teacher Federation is that working with teacher certifying agencies to establish a pre-service program on child and youth mental health for aspiring teachers in the Bachelor of Ed all across Canada. Because I've done a degree in psychology. It took me 5 years in total to do it, and I did a whole bunch of case studies, I did a whole bunch of research, I did a whole bunch of prognosis, diagnosis, tests on symptoms, and I still don't know enough. I still can't go in a room of 20 or more kids and say definitively, point out which kids need my help on their mental health. And if I took a degree and I'm certified in this and I can't see it, what about my peers? What about my friends in the program? What about the teachers that I meet? What about them? Kids need this support, and we're not giving it to them. And it's not about being a teacher. It's not about being a psychiatrist. It's not about being a politician. It's not about being any kind of professional. It's about being human. Because a healthy mind is a happy mind, and a happy mind is a learning mind. And we should be doing everything that we can to make sure that kids are living a happy, enjoyable life. I recently run the Ontario, Toronto